Right now there's a big boost in non-surgicals, actually. They're expecting it to like double in like 3 years or so. Also, non-invasive offerings such as freezing the fat instead of doing liposuction. There's other machines coming out right now that are very similar along the lines of non-surgical fat reduction. There's now machines for skin tightening with using radiofrequency or ultrasound rather than doing a facelift. You might want to try those. I'm hearing it a lot more that people want to look good without makeup, and I don't know if that is selfie culture, but their goal is to look flawless without being touched up. And I don't know if, again, that's a Facetune phenomenon or all the filters that we have now making everybody look perfect in pictures and people thinking that that's real, or if it is just, not unrealistic. I mean, I can get somebody to look Facetuned. It's a lot of work, not just on my part. It's a lot of time commitment on their part and a lot of money. So I have seen that, perfection as an aesthetic come to the forefront a lot more. As far as surgically, I would say breast augmentation is still very popular, but smaller breasts rather than those humongous pornographic looking breasts. People want to look more athletic. Lip filler is huge now because of the Kardashians. Buttock injections with either the patient's own fat or with filler is big as well due to them. I've had patients coming in for, buttock augmentation that had gotten liposuction of their butt when they were 20. So these things come and go. You would never think somebody would do that. That would be crazy to get butt liposuction. But, that wasn't in back then, 30 years ago. And so people were getting buttock liposuction, and now they're coming in to enhance it again. Same thing, I had a patient who had gotten a breast reduction 30 years ago, and then she came in for a breast lift and augmentation. A lot of them are coming in younger and younger in their mid-20s for Botox and fillers as a preventative rather than oh, I'm getting these lines, let me fill them. They're like, I never want to get lines. So microneedling is also very huge right now. A lot of these millennials have acne scars, and the only thing to fill them in, especially for anybody with pigmentation, is microneedling. When you go shopping for a pair of jeans and it makes your butt look good, you go get it in a couple different colors. Does that mean you're addicted? No, it just made your butt look good.
Yeah.
But people use that word all the time. Like, it's not a drug, it's not like narcotics or anything. You just feel better about yourself because you look better. That doesn't make you addicted. With that being said, you should have a surgeon that you trust who will tell you to stop. There are people that have body dysmorphia or have a warped sense of what is aesthetic, and I don't know. My aesthetic is natural is best. I just want to sort of make you optimize what you have, not make you look like a completely different person. So I do tell a lot of my patients no. Or if they've been to another injector and they're really blown up elsewhere and they want bigger lips, I won't do it until all that filler's gone, because then they're going to go tell all their friends, she's my plastic surgeon. They're going to be like, oh my God, I'm never going to her. You look crazy. So I do turn people away, and I try to stay very true to my aesthetic and my reputation so that everything's very consistent. My website, my marketing, my social media, everything is, and my practice is very consistent. My patients usually don't bring in pictures, and I'm kind of surprised by that. They usually just come in, if they bring a picture of anybody, it's going to be themselves at a younger age. And that's just the way I've built my practice. I haven't built my practice to make people look fake or look like somebody else. I've built my practice to be, we're just going to take a few years off of you, but you're still going to look like you. So I don't know why. Maybe that's why people don't bring me pictures of celebrities and ask me to look like them. Maybe they're going elsewhere. As we age, there's certain things that happen inevitably in all of us, like mid-face descent. The fat that used to be up here starts to fall, so you start getting this, and eventually jowling. That happens on all of us. And so their motivations are pretty much similar. They just want to look more lifted, less tired. Some of my, I do a lot of professionals, and they might say they're competing against younger people and they don't want to look old, they don't want to look tired. I hear that sometimes, but mostly it's just you know, I'm turning 40 or I just had a baby and, you know, I don't want to look like I did. So what is frustrating to me is that everybody's an expert now. Whether they're a pharmacist, whether they never graduated residency, whether they're a nurse, an esthetician, makeup artist, whatever, they're an expert now. I think it's very important for plastic surgeons to stay very on top of social media and keep putting out legit content, because there's so much misinformation out there by all these people claiming to be the so-called experts when they have zero or minimal training.